Hello, I'm Stephanie Mercado, CEO of NAHQ, the National Association for Healthcare Quality.
And I'm Patty Resnick, President of the NAHQ Board of Directors. As President of NAHQ, I'm proud to say that NAHQ continues to lead the industry in achieving our vision of the power of Q, better healthcare quality and safety, and better healthcare for everyone. I am honored to be able to highlight the significant progress NAHQ has made, as well as the measurable impact those efforts are having in advancing healthcare quality.
As the CEO of NAHQ, I see firsthand the steep challenges that the healthcare industry is facing. The need to reduce cost and improve care is accelerating, while the imperative to prepare the workforce for new technologies, new skills, and an ever-changing landscape is more urgent than ever. As the organization at the forefront of advancing quality and safety, NAHQ is leading the way to address these challenges. In fact, we've taken on the challenge of elevating the entire category of quality. So why did we take on this monumental goal? NAHQ's research revealed that the industry did not fully understand, appreciate, or even prioritize quality. There was no unified or clear-cut definition of quality, and surprisingly, 24% of people said they saw it as the responsibility of a select few instead of an important role for everyone. So, NAHQ set out to change that in a big way. Our Power of Q campaign educated and inspired the healthcare industry, boldly declaring that quality is not in the way, it is the way. You can't operate without it, and it's time to put quality on the table. The results were significant. Those who felt quality was the responsibility of a select few decreased from 24% to 8%, confirming that the industry now sees quality more than ever as everyone's responsibility. 94% agreed that quality improves patient outcomes, and 87% agree it delivers a positive ROI for their organizations.
Those results are truly game-changing for quality. NAHQ is achieving so much on our own, but we also know the power that can come from collaboration. In November of 2024, NAHQ entered an unprecedented strategic alliance with Joint Commission, joining forces to work together to advance quality and safety. In 2024, Joint Commission endorsed the NAHQ Healthcare Quality Competency Framework, the universal standard for healthcare quality, and the CPHQ, the only accredited certification in healthcare quality. Together with Joint Commission, we have awarded 30 CPHQ scholarships to 3 safety net hospitals across the United States. And in January 2026, we will be releasing another NAHQ micro-credential in regulatory and accreditation, powered by Joint Commission.
We're excited about this NAHQ micro-credential because at NAHQ we recognize that credentials and certifications play a critical role, ensuring that the profession is guided by universal standards and that individuals can demonstrate their qualifications and readiness for their work. In 2025, we celebrated the 40th anniversary of the CPHQ, the Certified Professional in Healthcare Quality Certification. This was an impressive milestone, made more impressive by the fact that we have certified more than 40,000 CPHQs to date. So, building on the foundation of the CPHQ, NAHQ took the next step and has developed a portfolio of micro-credentials aligned to the industry standard Healthcare Quality Competency Framework. Reminder, this framework identifies the domains and the competencies required to deliver on healthcare quality excellence. Each of the micro-credentials that we've developed really dives deeply into one domain of the framework, enabling CPHQs to further their knowledge and critical competency development and it allows non-CPHQs to really zone in and focus on targeted skills in those areas. The Health Data Analytics Microcredential was released in November 2024, followed quickly by the Performance and Process Improvement Microcredential in May 2025. In addition to the Regulatory and Accreditation Microcredential that Patty just mentioned, which is powered by Joint Commission, NAHQ will also be releasing 2 additional microcredentials in 2026. Look for patient safety and quality review and accountability.
NAHQ is well known for our industry-leading events. NAHQ Next, our multi-day virtual healthcare quality event, convened 5,000 registrants across the entire continuum of care to tackle healthcare's most urgent challenges. Healthcare Quality Week, a dedicated week to celebrate the impact of professionals working in healthcare quality and safety, brought together 23,000 registrants just this past year. And we continue to attract industry-leading speakers at NAHQ Next from top-tier organizations like Joint Commission, CMS, the ROI-Q Report, and more. We are grateful to the NAHQ staff and over 100 volunteers who dedicate their time and their expertise to bring these events to life.
An important way that NAHQ is leading the industry is with our thought leadership, which focuses on accomplishing 2 key things. First, it makes the business case for quality and safety. And second, it drives the industry forward through trusted data and insights. In 2025, NAHQ published a new report that was truly groundbreaking. We called it the ROI-Q Report. This report set out to do things that had never been done before. The ROI-Q Report had proven that competency-based performance can be elevated, that elevated performance leads to improved clinical outcomes, and that these improvements have a measurable impact on the bottom line. The results in the report were achieved with organizations working side by side with NAHQ to lead and activate the Healthcare Quality Competency Framework, and they did that by activating NAHQ's Workforce Accelerator Program. So the Workforce Accelerator Program is a customizable and scalable program designed to move organizations from fragmented efforts to a unified one with high-performing teams that are driving operational excellence and who are sustaining results. Here are some of the results. A 194% improvement in cost avoidance, $6.5 million saved over 2 years, $15 to $20 million in annual pay for performance incentive program gains, a 50% reduction in serious safety event rates, and a 92% decrease in hack penalties. And those are just a few of the results that the organizations that we work with achieved. So imagine what could happen if we replicated the work and we scaled it across the country and around the world. This program has demonstrated the opportunity for cost savings in the US alone to be in the billions of dollars. And very importantly, the potential harm reduction would be transformative for patients and for families.
In 2024, the NAHQ Board of Directors approved a new strategic plan that marks a pivotal evolution in our future direction and structure. While NAHQ continues in our unwavering support of the quality profession, we have also broadened our scope to represent the growing role of quality as a discipline across the continuum of care. We have welcomed 3 new board members, including a seat designated for a Joint Commission representative. In 2026, we will open additional board seats, ensuring our governance is guided by a range of expertise and represents the growth areas we have identified for the future of quality, with a focus on advocacy and public affairs, patient experience, financial stewardship, large-scale transformation, risk management, and safety and high reliability organization principles. I want to extend my gratitude to the current, past, and future members of the NAHQ Board of Directors who lead the development of NAHQ's vision. And with that vision, NAHQ continues to advance working with more organizations to help improve more outcomes. We are also impacting more individuals, engaging over 150,000 healthcare professionals and leaders from an increasingly broad spectrum of healthcare roles, clinical and non-clinical roles, from quality positions to frontline positions, to leadership, and from health systems, pharmacy, behavioral health, long-term care, and so much more. NAHQ is positioned to continue to prepare this workforce to meet today's needs and manage tomorrow's changes. We will keep making the case for quality and safety, measuring the ROI of quality, and continuing to demonstrate that if we tap into the power of quality, we have the potential to save millions of dollars and improve millions of lives.
Over the past 2 years, NAHQ has accomplished so much, and the work ahead of us is even more important. 2026 will mark NAHQ's 50th anniversary. That's 50 years of significant advances in healthcare quality. And I can assure you, NAHQ is preparing for an even bigger impact in the future. We have the plans, we have the programs, we have the people, and we have the proof of ROI-Q. So I know the best is yet to come.